You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, how small improvements made to your smile can change your life. According to my first guest, she says if you don't like your smile, you can do something about it in an affordable way. With us, we have Dr. Amy Creech-Gionis. Dr. Gionis, welcome to the program.
Thank you. Pleasure to be here. My patients call me Dr. Creech because I know that's a really long hyphenated name, so if that's easier, that's great.
Okay, good, good. Now, for people that don't know your practice, and we're talking about like smile makeovers today, who's the typical patient in your practice, and what are the different services you offer?
Oh gosh, we are a general practice, so we have patients that run the gamut actually. We see children all the way up through adults. There is no age limit. There is anything that needs to get done as far as your smile and your teeth, we can do it. We can take care of it in our office. So for example, the type of person we see may be a person who's missing, one or two teeth. They may be back teeth. And we will replace their teeth with dental implants. Give them a full complement of teeth. They can chew, they can be healthy. So maybe we have a person in their 50s or 60s, a business person. Pretty good smile, there's nothing really wrong with it, but it's just not perfect. They need to have brighter, whiter teeth. We can do whitening for someone like that. Maybe they have some chips or some spaces, something that's just detracting a little bit from their smile. Porcelain veneers are great for that person. They're busy, they don't have a lot of time, they want to have something done that's quick, but it's going to make a great big impact. Porcelain veneers are excellent. Very conservative, they're gorgeous, they look natural, they look lifelike. They have a choice of how they want the teeth shaped, what colors they want, if they want it to be very white, if they want it to be more natural, but we always tend to want the patient to have very natural teeth, so we encourage them to do that.
So do you consider yourself a cosmetic dentist?
Well, that's kind of a broad term. Everything that I do with cosmetics in mind, and I want everything to look great. I want everything to be beautiful. So the result I'm going for every time is absolutely cosmetic.
At the top of the show we said that small improvements made your smile can change your life.
Hugely.
Sounds like an overstatement. Elaborate.
It's not an overstatement. Can you imagine? Well, let me tell you a story about a 30-year-old girl that came into my office. She has two young kids, new marriage, young marriage. And she had been bulimic when she was younger. And so she'd had some acid erosion on her teeth, which makes the teeth shorter, a little thinner. They start to chip. They look a little bluish when they're thin like that. And beautiful face, young girl, healthy, vibrant girl, but she wouldn't smile. Why? Because she was self-conscious about her teeth. She would look in the mirror and she felt badly about her teeth. She also shared that her husband didn't tell her, she felt like he didn't look at her the same way anymore. He didn't tell her that how pretty she was anymore like he used to.
She tells you this on the consult?
Not in the consult, but over time as we're getting to know, you have several appointments sometimes. You have your teeth cleaned and you get to know the patient. But they do open up and they do share some of these things. And if you listen carefully, you can catch these little nuances. And I think what the straw that broke the camel's back with her was that one of her small children, because they will say whatever they think, pointed out to her, "Mommy, what's wrong with your teeth? Why do they look that way?"
Oh.
And she didn't realize that if a child is noticing something, obviously she's looking in the mirror and she doesn't like what she sees, but a child is noticing something, she thinks my husband's definitely noticing something, and all of this is giving her a lower self-esteem. So what we did for her is we did a set of porcelain veneers, and her countenance changed immediately. Her smile became broader, and she shared with me later, my husband tells me I look like him, like I looked when we first met, when we fell in love. That's a huge thing. I mean, so yes, it's teeth, and yes, it's a smile. What's the big deal? That changes a marriage. Now the children see a happier couple, right? They see.
That's nice. Okay.
I mean, think about it on those terms. The children are seeing a happier mom and dad.
Are there a lot of people that don't like their smile?
I
that
think
are
it's
walking
more
around
common
and
than
just
you think.
Really?
I think it's way more common than you think. Absolutely, and it can run the gamut from people who, if you meet someone that doesn't really smile and that casts their eyes down or kind of greets you with a handshake and a quick, closed lip smile, you might think that they're unhappy or that they're grouchy or just kind of not a happy person in general. It may have nothing to do with what's going on in their heart. It may have everything to do with the fact that they have low self-confidence about that smile. And so it affects how they approach you.
So you can spot it. Like
I
if
can
somebody
spot
is
it.
smiling with their mouth closed, they probably don't like their teeth.
I can spot it. I can spot it a mile away. If you look at a family photo, or if you see a photo on Facebook, and you see a group of people, and you see a lot of people with these big broad smiles, and everybody's laughing, and there's one person who's got that kind of a smile. Why would they smile like that? Obviously, everyone's laughing and having a good time. Something's going on. They're not happy with that smile, and it may even be an okay smile, but to them, something's going on.
Something's
that's huge.
bothering them.
Something's bothering them.
That's a quick fix or an easy fix.
It's a quick fix or an easy fix. Oftentimes, it's very easy.
I think we talked on the, well, we did. We talked on the telephone, and you were saying that you may do like a smile makeover, fix some things, and then
Yes.
there they are taking selfies
Yes.
on Facebook.
Yes.
Maybe irritating all their friends
Yes.
because now they're posting a ton of selfies
Yeah.
with their teeth
Absolutely.
showing.
Absolutely.
And
Yes.
ever since that conversation on Facebook, it's now I spot people that are smiling with their mouth closed. And it makes sense. I guess they're just embarrassed
They're embarrassed.
of their teeth.
They are.
Interesting.
Yeah, and it may not even be something that they're aware of. They may not even be conscious of the fact that they're doing that.
Really?
But they're doing it. Yes, absolutely.
And now, you're a dentist, so respectfully I say, well, of course you think the smile's important, right?
Yes, I do.
Because you're a dentist.
I do.
How important is it?
Well, there are studies that show that people who don't smile are deemed less trustworthy. They are, for instance, if you're on a job interview and you're neck and neck with another candidate, and one candidate is smiling and gregarious and open, and you are self-conscious of your smile, so you'll smile, but you're a little more, you're deemed a little more inward, a little more introverted perhaps. Your employer, whether he knows it or not, when he's evaluating these things, all things considered equal, otherwise, that employer is probably going to hire the person that's smiling because
That looks positive.
That looks positive. They look
Okay.
upbeat. They're considered more able to handle adversity. They're going to be more trustworthy. They're going to be someone that's going to treat the customer better. These are conceptions that are in that employer's mind. I mean, it's a fact. Studies prove these things. You're also a lot less approachable if you can't smile, or if you are self-conscious about your smile. Others sense that. I mean, you have about 7 seconds to make a first impression. And first impressions have nothing to do with reality, with what's going on in your heart, with the kind of person you are, with the level of education you have. Has nothing to do with that. Has everything to do with what that person is seeing in a snap.
Now, in your practice,
Yes.
you say you're very high tech, like you have all the tools to create this beautiful smile.
We do, yes.
What do you mean by that? What's high tech in dentistry today?
So dentistry is evolving quickly, and there is so much new technologies that's very exciting. In the past, when you would have dentistry done and you needed to have, say, crowns, bridges, implants, veneers, things like that done that requires an impression, you've got this tray that's full of this goopy material that kind of can leak down the back into your throat, maybe make you feel like you need to gag, like you can't breathe properly.
You gag, yeah.
Yeah, it's gaggy. We don't have to do that anymore. Now we have intraoral scanners that actually take a series of images that go onto a digital file, and with a press of a button, we send that digital file, which is a three-dimensional picture of your teeth.
So like a camera in the mouth?
It's
Just
a camera
like
in the mouth.
a wand kind of a thing?
It's a wand. All we have to do is wave that wand over the tooth, goes to a digital file, it's sent to the lab, and that's it. There's no impression.
That's
There's
nice.
no more. Oh, patients love it. We have an intraoral camera that can show a close-up picture of anything that we see. We can show them. We see it, they see it. In the old days, if they didn't have pain, they aren't really aware of what's going on in their mouth. So if we tell them that,
for example, like what?
For example, a broken tooth, a cracked tooth, a cavity.
That's right, you
anything
take
like
the
that.
dentist's word for it.
Take the dentist's word for it. And if they aren't having pain, patients associate something wrong with pain. So if they're not in pain, they don't perceive an issue or a problem. And that's not always the case. In fact, it's usually not the case. If you're in pain, you're already to the point where you're needing something like a root canal possibly, or you have an infection that's severe. We don't want to wait to that point at all. We want to get to things much sooner than that. We want to be preventive about things.
So you blow it up on the screen.
Blow it up on the screen. They can see it in real
big
life.
crack.
And when they see it, they say, oh my God, I want it. What's that? I don't want that in my mouth. How long has that been going on? that's got to go. Also, when we do fillings and things like that, now we don't use any kind of metal. It's much more cosmetic to have a tooth-colored restoration, but that's not the only. That's the plus side of it for the patient. But for me, they're stronger. They bond to the tooth. They don't leak like the old silver fillings do. They're a safer material, so those are all pluses. So we also do dental implants to replace missing teeth. And normally how it's done is you go to one place and have the imaging, you go to another place and have the surgery, you go to another place and have the crown made. But we do it all right here. We do it all in my office. So I can have it, the imaging done, I can do the implant, I can place the crown, everything in one office.
All right there.
All right
and
there.
And you do your own root canals?
Yes, we do our own root canals, we do our own surgeries. We do the extractions and the bone grafting if it's necessary to make the bone ideal for the implants. Everything is done right in my office.
Because people hate going to the dentist, right?
They hate
going to the dentist.
Do you hear that? I hear it every day.
Really?
Every single day.
Like, what do they say?
I have a very thick skin.
Like, no offense?
They say no offense. What they say is, I love you,
okay.
but I hate you. And, I get it every day.
Do you have a funny comeback after all these years?
I say, I have a very thick skin and I don't take it personally. That's all I say. I say, I know, I get it. But I do get it, actually, because I don't like dental work either. I'm also a patient. I have teeth and I have to sit in the chair sometimes, too. I understand that. It's a very personal space. It requires a lot of trust in your practitioner and in your team that's working with you. It's a scary thing, and it doesn't have to be, though. We do dental sedation. We make the patients very comfortable.
You're big on sedation.
Big on sedation.
You do IV sedation. I guess you also do the pill.
Yes.
Nitrous.
We have all
Do people use all that stuff? Is that big?
A lot. I do a lot of sedation. I believe in better living by chemistry is what I say. And that's my joke with the patient to kind of loosen them up when we're having the conversations about, they're a little embarrassed to ask for sedation, which is crazy.
Really? Okay.
Some of them, when they're extremely fearful, they come in because of sedation and they'll tell you, it took me a week to make this phone call. I sat in the parking lot for 20 minutes. I had to force myself in that. We know those patients.
Really?
Oh yeah, and I honestly have a passion for treating these kind of patients. I know a lot of dentists really have a hard time dealing with this type of person because they do take extra time. They take a lot of extra psychology to deal, with their issues. It takes a lot of patience, and you really have to have a heart for it if you're going to do it and do it well. And they kind of want to refer those patients out. So I get a lot of that type of patient in my practice, and I love them because it's a challenge, yes, but I like to sit and connect and figure out. To me, I like figuring out what's going on behind this. Why did they get this way? How did they, how did it come to be like that? So we always end up winning those patients over. There are a lot of times when those patients they start out requiring IV sedation, and then they kind of graduate down to just needing the nitrous oxide gas.
Because they're no longer afraid of the dentist.
They're no longer afraid, and then sometimes they come in and they're like, I feel good today. We don't have to do anything. That's incredible.
Now, is this true that in one day, so people can go in, walk in the day of the procedure, really bad teeth, and because of sedation, you could do like a year worth of dentistry all in one shot.
We do it.
And they walk out with a smile makeover.
We do it routinely.
Really?
Routinely. And that's one of the advantages of sedation dentistry is you can tolerate sitting there for 4 or 5 hours and having that much dental work done, not even know you had it done.
Because a lot of people are busy. I mean, whether you're running a company or you have 4 kids at home, you can't afford to go back and forth to the dentist is a hassle.
Correct. It's not only just about fear, it's about convenience, and it's about not having to miss work. It's not having to, take personal time. It's about convenience.
Now, some people, we talked in the green room. You said you have a family member, a very close family member. They have money.
And he knows who he is.
Yeah, okay. They go to the gym every day, so they care about the way they look. They look good, dress well, nice car, the whole bit, but they've got these old teeth.
Yes.
And you say even you can't talk them into doing it.
Yes.
And it's free for them.
Yes.
Tell me about that.
Yes, so this is a guy, he's good looking, he's healthy. Absolutely, he's my family member. He's going to get it for free. He has no reason whatsoever. He's not afraid. In fact, when he comes in to get his teeth cleaned, he falls asleep every time. My hygienists love to tell me this. There's no reason. He doesn't want the hassle of a lot of appointments. And a lot of people are like that. A lot of people have this misconception that it's going to take multiple appointments, and it doesn't have to. Porcelain veneers are done in one appointment. And as far as the time is concerned, because we can do sedation dentistry, we can do full mouth dentistry in one appointment. So, and they can tolerate it perfectly fine because they're basically sleeping through it.
With this person you're talking about, they can go in, get a little sedation, wake up, look at the mirror, and they got a beautiful smile.
Exactly.
You say it's more youthful smile.
It's more useful by far, yes. As we age, our teeth naturally wear. It can be from acid erosion from the foods we eat and drink. It can be from tooth grinding, lots of different factors, but it's just a fact. Our teeth are going to shorten and they're going to chip a little bit and they're going to wear over time. So if you look at older people, you will notice that they don't show much smile. When they smile, they don't show much teeth. That's just, and you may not realize that you're perceiving their teeth as one of the reasons why their face looks older, but that is what's happening. So if you have worn, chipped teeth, even if you're in your 30s, you're going to look a lot older. Your smile ages your face.
Now, you went to a reunion recently.
I did.
Could you tell people's teeth?
Yes, of
Like
course.
who needed good
Of course,
teeth?
I look at their teeth. In fact, sometimes I have to force myself to look at eyes because I'm looking at teeth, and I wonder if they can tell that I'm looking at teeth.
Your teeth are very nice. Are those veneers?
No, these are my teeth.
You must brush them every day.
I do brush them every day.
Brush them twice a day.
Yes.
Now, let's talk about porcelain veneers
Yes.
for a moment. Okay, so, you know, and we've talked a little bit, but I always feel like I could spot porcelain veneers walking down the street.
You should
10,
not
20
be able
yards
to.
in front of me. They seem big and bulky.
You should not be able to. Porcelain veneers, our lab is fantastic, and they look very natural. We custom design them to the smile. They follow the line of the lip. Again, when your teeth wear and they aren't showing up underneath the lip, and it's looking older, that's something that's corrected with a little bit longer. We kind of lengthen the teeth. We make them wider again. We can make them straight. People who have gaps or crooked teeth, things like that in their smile. If they don't want to go through orthodontic treatment, which by the way we do in our practice, then we can do instant orthodontics, which is basically...
They could have crooked teeth?
They can have crooked
and
teeth.
then instantly straight teeth with veneers.
Instantly straight teeth with veneers. Absolutely. They don't have to go through the 2 years of orthodontic treatment if that's not something that they want to do. So Randy, when you say that you see porcelain veneers walking from 10 feet away,
Yeah, they're big, yeah.
then I think maybe that just is maybe a poor design of veneers because they should not be that way.
So whose fault was that?
Well,
Like for example, was that the patient wanted big,
sometimes,
bright teeth,
believe it or
was
not,
the
it
doc-
can be a request of the patient that they want to have these chiclet white teeth. But I think it's the responsibility of the cosmetic dentist to kind of educate them and let them know what looks natural and what looks best. And we take a lot of time doing that with the patient. And properly designed veneers, they look natural. They look beautiful. Someone who sees you after they haven't seen you in a while and you've had your teeth restored, they might not notice what it is about you that's different. Something's different. They may ask you, "You look great. Did you change your hair? Have you had a facelift?"
Is this what they tell you?
They tell us
like
that.
when it's all done, they say that people are asking them,
They tell us that. And they walk into the office differently.
Really?
There is a difference in their countenance.
Once you fix their teeth?
Absolutely. Oh,
Okay.
yeah. I had one patient who, actually he had a denture and we ended up giving him implants and securing a new set of teeth with implants. So his teeth no longer had to come in and out. When he used to come in, he came in looking like an old man. He wore slumpy clothes. He didn't really care about it. His hair was never done. He was unkempt. And after this, he came in. He actually had colored his hair. Okay. So he no longer had gray hair. In fact, I didn't recognize him as I was glancing past him at first, standing at the front desk. He clearly had colored his hair. His hair was fixed. He had some cologne on. He was walking with a little spring in his step. It was a different person. And that is, we see it all the time.
So you change their teeth and they start taking better care of themselves.
Better care of themselves. Yeah, they're out there now. He was dating. It was a different lifestyle.
So when should somebody get like a smile makeover or porcelain veneers?
Randy, if there's something about your teeth that you don't like, fix it. There is no reason to live with something that you are unhappy with. It's too easy and too affordable these days to have your teeth fixed and to look in the mirror and be proud of what you see, to not take care of it. There's no reason. Modern dentistry is so good and so accessible and so affordable that there's no reason to live like that.
So let's move on to the veneer process.
Yes.
So how do you help them know what their teeth are going to look like? I guess that's my question.
So, well, there is, there are a few steps that are involved. The first thing that I do is take some time figuring out what it is exactly that the patient does not like. Give them a mirror, have them point it out to me. What goals do they have? What do they want to look like at the end? We kind of need to know what it is exactly that's bothering them. Once we kind of figure that out, then I can show them before and after pictures. So once they tell me what bothers them, I can tell them what I see, and I can tell them what the possibilities could be. We can look at before and after pictures. I usually do something called a diagnostic wax-up, which I actually take models of their teeth and have the laboratory fabricate what I see as ideal and beautiful. And then I can show the patient, and they can hold it in their hands. They can actually open the models and look at the teeth. They can say, I love that. I think that's really pretty. Or, I don't want my two front teeth to be a little longer than, I want them all even. I want these teeth bigger. They can help me in the process of the design process, tell me what they see in their mind, and we can mesh them together for a perfect result. So then what we do is we can actually give them a temporary smile, which is almost like a trial run. So we can prepare their teeth, and according to the design that we've agreed upon prior, with the diagnostic wax-up, that is actually in their mouth. They get to decide.
But they're not veneers yet.
They're not veneers yet. They're temporary veneers.
So they
and
get to see what they
can
look
wear
like.
those for a couple weeks if they would like. Try it out. Let their spouse see it. Let their loved ones see it. Let their friends see it if they want to share that. If they want to get opinions, we can still change anything that wants to be changed at that point. And so they have a lot of input. It's not simply blind trust coming in and not knowing what you're going to get at the end, which is one reason why a lot of people don't pull the trigger when they're thinking about doing porcelain veneers. They're just afraid that when they go in, they don't know what they're coming out with. It doesn't have to be that way, and it's not that way. So when I first show them their temporaries, and I hand them the mirror just with their temporaries, which are just made of a resin. They're not the porcelain yet. It's just a composite resin material, like a plastic, basically.
All right.
They look great, but they're still not the real thing, which are even going to be better. I hand them the mirror, and they stare, and they sometimes have tears, or they react with this reaction.
Nice.
That's so much fun to watch. And I tell them, if you like that, wait till you get your permanents. If you like the temporaries, this is good, but this is not perfect. So that's exciting. That's pretty cool. So a couple of weeks later, they'll come back. They're happy with everything, and we place the permanent porcelain veneers. And they're beautiful. They're translucent. They should look natural. They have natural contours and ridges like natural teeth. They don't look like chiclets or piano keys. They're not too white. Okay. They're not, flat looking. They look like natural teeth. And they're just thrilled. They're thrilled to death. They go home. They have, their spouse tells them, you look incredible. You look beautiful. They go out and buy all new lipstick because they want to highlight their smile. You see them taking a lot more pictures. I had one girl tell me, I love going out with my girlfriends now because we have so much fun. And before, when we would go out, I was always a little self-conscious because I felt like they were all more attractive than I was. And so when they would laugh, I would kind of laugh with, my mouth closed. Now I feel like I want to go out more. When we go out for cocktails, I'm all in. And
do people do this for an occasion, like they're getting married, daughter's
Absolutely.
getting married?
Yes.
They're single, maybe for the first time.
Yeah, that's huge, especially with, I find, my 50 and 60-year-old patients. It's interesting. And by the way, if you care about how you look, you eventually will probably need veneers. I mean, if you honestly...
What do you mean by that?
What I mean by that is all of us, everyone's teeth age. No matter how well you take care of them, everyone's teeth age over time. Like I said before, there's wear, there's chipping, there's wear and tear, there's acid erosion from our diet, there is darkening from coffees and teas and red wines and things like that. Even if you whiten your teeth with, whitening materials, there comes a point in time where your teeth don't whiten as much with some people. They just become a little resistant to the whitening. So if you really want to look your youngest and your best all the way through your lifetime, chances are there will come a point in time where you want to have veneers done because of that wear. And you just...
How do you choose a dentist that's going to be because not all dentists, I guess, do it at this level. In fact, you said you're going to ongoing training. all the time, this continuing education. Is there really that much to it?
There is.
Okay.
If you want to, for instance, there could be a whole course on the aesthetics of just top front teeth. Hours and hours of talks about that. It is one of the hardest things we do to match one single tooth. You would think restoring the entire mouth is the hardest thing. Sometimes the most aesthetically challenging thing we do is putting one single veneer on one single front tooth. It's an art. It's not just something.
Is it more art than science?
It is more art than science by far. Dental school is all about the mechanics and teaching you how to do a filling and how to do things. But there's an artistic side and an artistic eye that is required, and some people love it. Some people love that artistic side, and you really need to find someone who has an eye for aesthetics.
Now we are out of time. We have about a minute left. But at the top of the show, we said that small improvements can make a big difference. And we've already talked a lot about these full mouth smile makeovers with veneers.
Yes.
But what do you mean by small improvements? An example.
If you have a gap in your front teeth, some people like the gap, some people hate the gap. If you have pointy canines, if you have lower front teeth that have gotten crowded over time, that shows when you're speaking, you see the lower teeth. People are looking at your lower teeth.
That's a good point. Okay.
Yes. If you have crooked teeth that are overlapping in the front, or you didn't wear your retainers and you're getting some orthodontic relapse, take care of it. Let us take care of it. There is no reason not to take care of these small cosmetic improvements that can make a huge difference. And you're going to love what you see in the mirror. And there's an uplifting feeling when you can look at yourself in the mirror in the morning and feel proud of yourself. You are going to have better self-esteem. You are going to feel less stress. You are going to be more confident. You're going to approach people differently. You're going to be more approachable. And there's just absolutely no reason why we can't take care of it. It's comfortable. It's affordable. It's not invasive.
And you have sedation, obviously.
We have sedation.
Might as well get sedated while you're there.
Absolutely. There is no reason not to. Yeah, safe.
And you could do a lot of work in one day with sedation.
A lot of work in one day.
Now that family member, hopefully they'll watch this. You said earlier in the show.
I'm working on him.
That his teeth have just aged.
Yes.
So one afternoon,
done.
could change everything.
Done.
Okay, good. Yeah. Now, on your consults, because I know you work with a team. I mean, you have a fairly large practice.
I do.
They get to see you. They get to see one of the associate dentists.
Yes.
For the smile makeovers. Will they meet you?
Absolutely.
Usually?
First appointment, they're going to meet me. Yes. And I'm going to find out what the impetus is for their visit. Why they came in. What can I do for them? I'm going to get to know them. I'm going to get to know their desires. I want to know what their end result is that they have in mind. And I also want to know what the barriers are to treatment. Why haven't they gotten treatment before? Are they afraid? Do they worry about the financial side? Are they thinking it's going to hurt because it's not going to hurt? Are they going to miss too much work? And all those things, we're going to find out what the barriers are and explain to them how easy it is that we can overcome anything that they may have thought was keeping them from
in one day,
taking care of
in one afternoon.
In one day.
Okay, good.
Yes.
I want to thank you for coming on the show. Very interesting.
Thank you.
Appreciate you coming on the show.
I appreciate you.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.